Today we're going to review the process for assessing a patient for depression. The first step is to identify if the patient is due for the measure. This will be done by the clinical team members, in this case, the medical assistant. To identify if the patient is due, the medical assistant will leverage the health reminders on the right-hand side of the patient's chart. By hovering over it, we can clearly see that the patient is overdue for this measure. To verify that, we're going to utilize the charge history on the left-hand side of the page by clicking on it and ensuring that we are filtered by description to make it as easy as possible. And we're looking for that 1220F code, which description is patient screened for depression. We can see here that the last time the patient was screened for depression and that 1220F code was dropped was on June 11th, 2015. So the patient is due for depression screening. Now that we have that identified, when the patient checks in for their visit, the medical assistant will provide them with a paper copy of the screening tool. Once they receive that back, they'll open up their encounter note, click on Forms in the upper left-hand corner, access the HCN form directory link, and come on over to that clinic team form. Today we are working on a PHQ-9. And here we're just going to transcribe over exactly as the patient answered, making sure that we're keeping track of our score. So here the patient has a score of 6. MA is going to make sure that they enter the 6 in the total score box. Now that we have that, as well as the answers, we're going to save our work. Last step for the medical assistant is to document that 1220F code. We're going to do that by coming over to our Orders and Charges tab. First, identifying the diagnosis that we'll attach the code to. In this case, we utilize the Z13.89, Encounter for Screening for Other Disorder. You can use the number itself or type in the description here. Either way, whatever's easier for you, both will get you the same result. Click that and drop it on down. Now we have to find that 1220F code. There's 2 ways that you can do it. First is by utilizing the procedure 1220F. We'll drop it down for you here. If you happen to forget what number you're looking for at the time, remember you can come over to your Favorites tab, utilize your Category 2 procedure codes, scroll down, and look for that 1220F patient screen for depression. So either way, same results, 2 different ways to find it. Once we have both the diagnosis and the 1220F code dropped, we're going to save our work because we are done. Now that the medical assistant is done with their piece, it's the provider's turn, and they have an equally as important role as the medical assistant. Once the provider identifies that a PHQ-9 was done and the score was 6, right here in the assessment, they're going to automatically know that there's going to need to be a follow-up plan initiated for this patient. Utilizing the forms in the HCN form directory link, we're going to come to our Quality Measures tab, which we should be doing with every visit. Click on the depression. Here we can already see that the PHQ-9 score of 6 has been transferred over from the MAs inputting it. We see down here that it's a mild to moderate symptom. And we're also going to identify a follow-up plan. What are we going to do for this patient? Today, we're going to refer this patient to a psychiatrist. And by clicking this, we need to make sure that when we go back into our Orders and Charges, that we do make that order, drop that referral for the patient. Save our work. Come back into our Orders and Charges. We have our referrals. Okay. We're going to drop that order for a psychiatrist. And also we want to verify, because everybody's responsible for this measure, we want to verify that the 1220F code has in fact been dropped under the proper diagnosis. Once you've done all of those, you are done for this measure and 100% compliant.